Hi there. Welcome to the While You Wait podcast, where it's all about helping women just like you learn about the bladder while you're waiting for your appointment with that specialist. Each week, I'll combine science, medicine, and common sense so you can learn, become empowered, and get started on your journey to dryness. I'm your host, Dr. Sarah Boyles, a board-certified urogynecologist. Let's get started. Hi there. Today I wanted to sit down and talk to you about all the things that you can do before you're seen in the office. My podcast is called While You Wait. I initially designed it because we had a long waiting list for patients to be seen in the office, and it was to help people get started. And I was super hopeful at that point in time that things would get better, but our waiting list has actually got a lot worse. And some of that is because I'm going to be out of the office on a medical leave for a little bit, taking care of my breast cancer, which is very, very treatable and will be fine, but is taking some time right now. And that just means that there's no way around patients having to wait. So I just wanted to talk to you about the things that you can do where you're seen in the office. I would also tell you that I work with several nurse practitioners and physician's assistants who are wonderful and do a great job. We talk about protocols, any complicated patients they talk to me about. They too do a great job, and I'm very comfortable having them start the evaluation process. Even if you're somebody who knows that they're going to go on to have surgery, we've changed the way we've done things a little bit. There's going to be a period where I will be available virtually, but not in the office. And so if you're someone who needs surgery, I might ask that you see one of my team so that they can get your history and they can get your physical. And then I trust their physical exam. I would definitely want to examine you before we operate, but I can talk to you about the details of the surgery and what I might recommend remotely if I have that documented exam. And so that's also something that you might choose to pursue doing this time. So the first thing that I would tell you is take a deep breath. We'll get you through this. It may take a little bit longer than you want. I think that, patients who have pelvic floor issues tend to try to ignore them for a long time. And then once they decide it's time to address it, they want to address it very quickly. And that's just something that we're not going to be able to accommodate right now, but we will address it. I think it's important for you to take the time to journal your symptoms. I want you to write down what is bothering you, what you do that makes it worse, when did it start, right? Is this something that you've had since maybe a childbirth? Did you notice it after menopause? Sometimes with prolapse, patients will come in because they were doing something like moving and doing a lot of heavy lifting, and then they notice a problem. All of those things are super helpful for me. I want to know if it's associated with anything. Did it happen after a surgery? Do you feel like medications make it worse? Childbirth? And so it's really helpful when you come in if you have kind of a list of the symptoms that bother you and you have really taken the time to figure out what is making it worse and what is making it better. With incontinence, I'll frequently ask people to do what we call a voiding diary. And in a voiding diary, you are writing down what you're drinking in 24 hours and actually measuring it. And then you are writing down when you are going to the bathroom. Sometimes we'll have you measure it so we kind of know volumes, but also when you're having the problem, right? When you're leaking, how often you're going to the bathroom. And doing that type of exercise will frequently give me a lot of information and will help me tell you what behavioral things you need to modify to improve your symptoms. I've had a lot of patients over the years who have done their own voiding diary. And then once they kind of write it down, they realize what is going on and what's creating the problem. And sometimes it's as simple as, oh my gosh, when I drink sparkling water, I have a huge amount of urgency. And if I stop drinking sparkling water, that goes away. Sometimes it's a little bit more nuanced than that. Sometimes you're drinking too much, drinking too little. But there are often things that we can do to improve your symptoms. So I think journaling in that way and really taking the time to think about your symptoms is super helpful because then you are coming in with all of the information. I think it's also important for you to take some time and think about what you are willing to do to fix the problem. How much time do you have? Right. So some of the recommendations that we make are pretty time intensive, right? So are you someone who would have time to go to physical therapy? Do you not have time to go to physical therapy, but you're interested in a more conservative approach? And so we need to come up with something that you can do at home. Those are all really important things. If you come in and you see me and I say, well, I really think you should do PT, and you say yes, and then you come back in, let's say 4 months and you say, well, I tried doing PT, but I really didn't have the time, so it didn't really work. That is not a great use of your time. And then, we really haven't made any progress. So being aware of your own limitations, what you're willing to do, what you don't want to do, the big categories of things that we do to improve pelvic floor disorders, physical therapy is always a big one. And I guess actually I should take a step back and say pelvic floor muscle strengthening. There are different ways that we can do that. I do think that PT is the gold standard, but there are other ways that we can do that if you really can't get to PT. And I think let's say, a working mom adding something on like a weekly PT trip it can be pretty difficult. So it's important for you to know that. So pelvic floor muscle strengthening, medications, including hormones. Sometimes we use pessaries. So pessaries are inserts that go into the vagina that can help with leaking or help with prolapse. They work very well. Sometimes I think of them as a permanent treatment. For some patients, they are a bridge to surgery, meaning that you can use them to keep you more comfortable before you're ready to have a surgery, or even, at this point, it might be before we're ready to do a surgery, right? So sometimes I'll have patients wear a pessary for 6 months until we can move ahead with surgery. So that's an important thing for you to think about as well. There are different procedures that we can do for overactive bladder. Sometimes we do nerve stimulations, and there are different nerve stimulations that we can do. And then, there are surgical procedures that can happen. And it is just kind of important for you to have an idea of what you're thinking about, because we can move more quickly if what your limitations are and what you are most interested in. And I think it's also reasonable for you to say, I think I'm interested in pessary. I would like more information before I come in. And that's definitely something that we can do. It can be hard to give you more information on surgery because surgery can be pretty nuanced. And so the details of you might end up looking up an awful lot of surgery that doesn't necessarily apply to you. So, for example, when I talk to patients about prolapse, there are kind of two big categories of how we correct prolapse. So one is closing the vagina, and that's called obliteration. The other one is reconstructing the vagina. And so that's kind of the first branch of the decision tree, which one of those you're interested in. For most women, obliteration is not a great option. And so I just kind of mention it and then we move on. And then when we're talking about reconstructing, it depends on where the defect is. Is your uterus coming down? Is the top of the vagina coming down? Is it the vaginal wall with the bladder behind it? Is it the vaginal wall with the rectum behind it? So it depends on where the defect is. Sometimes we do hysterectomies. Sometimes I don't do hysterectomies. Sometimes I use mesh. Sometimes I don't use mesh. And all of that kind of depends on what you want, how you feel about a hysterectomy, how you feel about the mesh, and then your particular anatomy and what I think would work the best for you. And then we have to take some time kind of defining what best means. So some patients will pick a surgery that has a higher failure rate, but doesn't use a piece of mesh, and that is kind of their definition of best. Sometimes patients will pick a mesh because we think it'll be more long acting, and that seems like a better choice for them. And so it's important to kind of go through all of those different options with you. but it's always a good idea to do some research ahead of time. For urinary incontinence, one of the first things that we frequently do to improve urinary incontinence is to work on pelvic floor muscle strengthening. And so if that's something that you're interested in, you can actually do that before you come into the office. For most patients with that, you can actually go to PT without a referral. And so that's something that you can explore. Both the Legacy and the Providence system have really good pelvic floor physical therapists. Therapeutic Associates here in Portland also has really good pelvic floor physical therapists. Westside Physical Therapy does too. So there are a lot of different options. If you're interested in a physical therapist, you could call the office. We could give you a list of, recommendations, and you could look at that even before you're a patient. And that's a reasonable thing to do. If you're not having pain, you could work on strengthening on your own. And there are lots of different options out there that you can look at. The PeriFit is a pelvic floor trainer that can help you increase your pelvic floor strength. You can do Kegels on your own. You could use vaginal weights like the Kegel Bell if that's something that you were interested in. There are also some online classes that can help with pelvic floor strengthening that you could look at. The Vagina Coach puts out some really good content, as does Mama Made Strong and my PFM. And I can include those links in the show notes as well. The one thing about pelvic floor strengthening is that if you're someone who's having any pelvic pain, I definitely would not want you to do that before that pain was evaluated. If you're someone who feels like they have a unexplained discharge or infection, that's also something that we would want you to do. We would want that to be treated and addressed first. But for many people, beginning to work on your pelvic floor strengthening is a great place to start. And even when pelvic floor strengthening is not the only answer for women, it is frequently part of the solution, right? And so it's a really important thing to address. So I hope this is a little bit helpful to you. I'm sorry that we are backed up at this point in time. You're taking the time to go over your symptoms, work on pelvic floor strengthening, thinking about what you want. Working with my team in the office and getting started is super helpful and will help us kind of move you along your treatment pathway. And, if you're someone who is waiting to see me in the clinic, I hope I get to meet you soon. Thanks for listening. If you want more information about me or my online work, check out my website at www.thewomensbladderdoctor.com.